staff, members of the committee. My name is Kimberly Adams, and I represent the interests of public educators. I'm a resident of Fairfax County, parent of a school-aged child, the wife of a sixth grade teacher, and a school librarian myself. I'm deeply invested in our public schools. Over the past 5 years, educators across the Commonwealth have seen their salaries stagnate. With increasing costs and changes to my VRS, my take-home pay has actually decreased. I see more and more of my colleagues frustrated and quite frankly fed up with an increasing workload, decreasing pay. We support Governor McAuliffe's inclusion of the state's share of a 2% increase in salaries across the state. We also support increased funding for pre-K, which is critical to sending our students to school ready to learn. And we know that the return on these investments is enormous. It's also critical that the state maintain a commitment to our VRS fund for the future of educators not yet retired and those who would like to retire someday from this profession. Medicaid expansion is also good for Virginia. We know that these 400,000 Virginians need medical coverage and that money will actually help free up additional dollars for our general fund. And our neediest students, their families, their parents, must have your leadership on this issue. In Fairfax County, we've seen dramatic cuts to schools as well as other county services with the impact of sequestration and the recession. The cost of competing funds as well as an overall increase in state funding for Fairfax will make a small but significant difference. The money invested in education and other state services comes back to citizens tenfold. The timeline for your state budget decision is going to have a significant impact on local county budgets, as they are working on estimated projections for state revenues. These affect all areas of the Commonwealth as we prepare budgets for coming fiscal years. In closing, I hope you'll work to convince your colleagues in the House that this budget is best for all Virginians. The citizens watch you very closely every day, and we know the leadership we expect in our General Assembly. Take time to lead Virginia in the right direction. Make a difference for our great public schools and all Virginians in need.
Thank you very much.
And I have Mr. Wells' speech, number 29.
Okay, thank you. Kathy?
Charlotte Mayer on this.
Number 30, Kathy Ravel. Number 31, Chantel Land. Number 32, Kelly Fitzgerald. Number 33, Robin Tyler. And I have it here. What is your name?
Kelly Fitzgerald kindly gave me her time.
All right, thank you. And your name?
My name is Ashley Chapman. I live here in Richmond, and I'm a constituent of Senator Marsh. The Virginia chapters of the National Multiple Sclerosis Society continue to strongly support closing the health insurance coverage gap that exists because we have not yet acted to expand the state's Medicaid program. We urge you to resolve this issue quickly, put people before politics, and work with the members of the House of Delegates to stop wasting our hard-earned tax dollars. Every day that state legislators choose not to act, Virginia loses $5 million. What would $5 million mean to people living with multiple sclerosis? We estimate that $5 million would purchase 50,000 lightweight and non-motorized wheelchairs. It would pay for nearly 200,000 hours of skilled home care. Or perhaps $5 million would pay for 500 to 800 MRIs, which are critical in diagnosing and monitoring the progression of MS. This is an important issue for the National Multiple Sclerosis Society, and accepting the federal money to provide health insurance to 400,000 of Virginia's uninsured population simply makes sense. We are encouraged by the efforts of the Virginia Senate to move forward, and we urge you to keep moving in the right direction. Thank you.
Thank you very much. Let's see, Herb Walker, or Walkie. Wow, I'm not going to know that in followed by John Gress, followed by Shirley Martin.
So my name is actually Ben Paul, but for the very kind enough to give me his spot here. So let me just start by thanking you both. Thank you, Senator Colgan, Senator Stosh, and the rest of the committee for your enduring patience as always. So as I said, my name is Benjamin Paul, and I am here today to speak on behalf of the Healthcare for All Virginians Coalition. The coalition is made up of over 100 organizations representing consumers, doctors, nurses, hospitals, state leaders, local governments, and lots of folks you principle that all Virginians should have access to affordable, quality health care. Closing the coverage gap will provide quality health coverage to nearly 400,000 Virginians, as well as create 30,000 new jobs. It would create significant state savings that can be invested in our teachers, first responders, and mental health system, as you've heard from many folks today. Unfortunately, instead of working toward a compromise, some of your colleagues are choosing to waste our money by playing political games instead of finding policy solutions. As of today, legislators in the House of Delegates have wasted $450 million. $450 million of our own money. Tomorrow it'll be $455 million. By the end of this year, it will be approximately $2 billion. To put that in context, Virginia's cost of closing the coverage gap in state fiscal year 2021 is $12 million. So in other words, lawmakers in the House of Delegates are so worried about the potential future costs of Virginia, they're perfectly happy to waste $450 million of our own money right now. I don't know if that makes sense or not, but maybe someone can tell. So some of the folks here, and I know a lot of folks out there are saying that, they're demanding that this issue be separated from the budget. And it's an attractive proposition, but it's also very strange when you consider that nearly all past decisions regarding Virginia healthcare programs, including Medicaid, of course, have been hashed out as part of the budget. So, for example, Virginia State Health Insurance Program, SCHIP, was initiated in the 1998 budget bill. The famous MOMS program was also initiated through the budget. The waiver expansions for intellectually and developmentally disabled folks, all done through the budget. In fact, we've already done Medicaid expansion through the budget once before. Governor McDonald, before the Supreme Court, ruled the expansion optional. He included the funding for expansion in